This is a bear crawl hold. I'm gonna get on hands and knees, find a comfortable low back position. Brace is almost like somebody's gonna poke or tickle me. I'm not gonna let them, so I'm getting a brace of the core. I'm gonna get some external rotation of the shoulder, which is crease of the elbow towards thumb index finger, push away from the floor, and then lift my knees about 2 inches off the floor. Not 6 inches or 12 inches, 2 inches, just a hover off the floor. Final step, pull your palms to your knees and your knees to your palms. You're not going to see anything on the video other than maybe me starting to shake. And then take some breaths in through the nose, out through the mouth. And as you exhale, try and bring the ribs down and squeeze in through there. So that's the bear crawl hold, hovering, but I want you to get in some of these positions and think about some of these activation techniques. First, at the shoulders, I mentioned to externally rotate and push away from the floor. So externally rotate is crease of the elbow towards index finger and thumb. Ton of videos on that, but it gets more muscle activation in the back of the shoulder. And then pushing away from the floor, that's protraction. Gravity's trying to push me down, I'm trying to push away. I'm trying to do that without shrugging. It's usually not intuitive to shrug in this position, but if you're feeling like you're shrugging, get the shoulders relaxed and think about keeping space between ear and shoulder. And then after every maybe 20 seconds or 3 to 5 breaths, reinforce that push away from the floor because it'll start to sag downward. On our low back position, we're not trying to get to any too convoluted of a situation, just finding what feels comfortable and maybe bringing the tips of the ribs towards the waistline a bit. Gravity's pushing down and it's going to try to get me into an arch position, but usually in quadruped and hands and knees, it's not too dramatic, but we might want to cultivate a little more of a downward motion of the rib cage, thinking about getting pelvis and rib cage parallel to each other. So that would be anterior forward rib flare. That would be kind of crunching down. There's some pelvic tilting. Don't worry about any of that. Just find what feels comfortable and neutral and maybe do a small baby crunch there and then brace like somebody's going to poke or tickle you. So that's the setup. And then I push away from the floor, externally rotate, and then I cued squeezing palms to knees and knees to palms. That's this way and the knees traveling up. That's going to cue the lats and more of the core in the chest. It's going to make it way harder to hold that isometric. So this can take this exercise up to a 10, no matter what your skill level is or what your experience level is. This can make it pretty dang challenging. Do that hold as hard as you can to hold the position for the desired time. So if it's just a little bit to get to 30 seconds, that's fine. Work up to more of an intense muscle contraction. But this gets more of an activation of the lats as I'm pulling down, of the front muscles, maybe even the obliques a bit, and it really helps to add to the exercise. 2 notes on comfort. If your toes are uncomfortable in this position, at this bend, get a roller, put it under the front of the ankle joint or the foot. Otherwise, the exercise remains the same. That offloads the foot. As you're pulling palm to knees and knees to palms, we just don't want to move the roller. Usually doesn't go very far, but you might take a weight and kind of block it or something so it can't go anywhere. The other one is wrists, comfort in this wrist position. So if that's an issue, grab a set of dumbbells. And same deal. I don't even have matching dumbbells here. I have a 5 and a 10. I'm just using them as a handle. So great exercise. I know I went on a bit about the technique, but really the technique is fairly simple. Really the shoulder activation I find is what gets people, because then they end up kind of holding here where we want to be more externally rotated and not shrugged up into the neck. But give it a shot. Usually start with a 30-second hold, often max 45 seconds, because if I'm engaging and breathing, I should be pretty challenging by 20, 30, 40 seconds. I find if we're going a minute or more, start to lose focus or lose intent on a lot of core exercises. So give it a shot. Let me know what you think.